Hello, I am Bernard from Bangor University. Let me briefly discuss with you about our recent study on infection prevention and antimicrobial stewardship interventions in healthcare settings. Infections can easily spread within the healthcare environment, especially when there are breaches in compliance with the standard precautions that are aimed at limiting their spread. When this happens, the microorganisms responsible for the infections can easily mutate as they adapt to the environment, and this makes them even more lethal when they are passed on to susceptible individuals. This continued spread of infections also increases the need to use antibiotics in their treatment. Unfortunately, there are many instances when antibiotics used to treat these infections are not always appropriate, and this aids mutations in infectious microorganisms as they acquire resistance against those antibiotics. Infection prevention interventions are useful to limit the spread of infections, while antimicrobial stewardship interventions have been implemented across health systems globally to promote the judicious use of antibiotics, which is useful in reducing the burden of antimicrobial resistance. In our study, we reviewed publications from different countries on infection prevention and antimicrobial stewardship interventions and summarized them under the acronym ESCAPE-BIN, which refers to education of staff, surveillance systems, consultations within multidisciplinary teams, audits and feedback systems, protocols and guidelines, environmental decontamination measures, bundles of care, isolation precautions, and notification systems. We also observed a paucity of evidence around the application of psychological and behavioral theories in the design and implementation of both infection prevention and antimicrobial stewardship interventions. Although these interventions have previously recorded significant reductions in the spread of infections and improved the use of antibiotics, they could be further strengthened through the application of behavior change techniques to improve their effectiveness and sustainability both in the short and long term. For more information about this, please follow the link provided below so that you can read our full research on this subject. Thank you very much, and bye for now.